Welcome to the State of Hawaii Title V Priority Summary. Let's take a look at our evidence-based priorities, strategies, and outcomes as of August 23, 2018. To start, for women and maternal health, Hawaii selected promotion of reproductive life planning. For perinatal infant health, reducing infant mortality through breastfeeding and safe sleep promotion. And for child health, developmental screening targeting 0 to 5-year-olds, prevention of child abuse and neglect, and oral health. Priority 1 is to promote reproductive life planning. First, by using evidence-based strategies to encourage the use of long-acting reversible contraception as part of reproductive life planning, and the one key question, would you like to become pregnant in the next year, to encourage preconception healthcare visits. Systems building work is conducted through collaboration with partners. A statewide private-public partnership continues to lead efforts in this area. A major success is the issuance of a memorandum by the state Medicaid program with guidance on coverage of contraceptives, including improved reimbursement and stocking of LARC at birthing hospitals and support for OKQ use. Plans include continuation of OKQ provider training, evaluation of the new Medicaid provider policies, and development of public awareness messaging on healthy behaviors to support reproductive life planning and preventive women's healthcare visits. One priority for reducing the rate of infant mortality is to increase the percentage of WIC infants ever breastfed. The key strategies to do so are to strengthen programs that provide mother-to-mother support and peer counseling, use community-based organizations to promote and support breastfeeding, and promote systems building through collaboration and networking. Working with the Hawaii Maternal Infant Health Collaborative, a state breastfeeding strategic plan was completed. WIC co-convenes this collaborative effort while continuing its successful breastfeeding peer counselor project, which provides group and personal supports to WIC moms. Moving forward, our activities will focus on implementation of the breastfeeding strategic plan that addresses 4 key areas for systems change: leadership, messaging and training, laws and policies, and targeted supports for mothers and families. Priority 3, reducing infant mortality through safe sleep. The focus for safe sleep promotion is to ensure Hawaii's birthing hospitals have established policies and protocols, developing appropriate and consistent educational messages, and assure training and adequate resources to all family service providers. All Hawaii's birthing hospitals successfully established safe sleep policies and protocols following AAP recommendations. A new safe sleep training requirement was implemented for all licensed childcare providers. Finally, the State Child Death Review Program was reestablished, a critical source of data to prevent sleep-related deaths. Future plans are to sponsor the annual Safe Sleep Summit, collect family input to refine educational messaging, and explore and evaluate prevention programs in conjunction with the state DHS entitlement programs serving at-risk families. Priority 4, increase developmental screening and services. The priority for developmental screening is to increase the number of children receiving developmental screening and services through policy and public health coordination, systems development, data integration, and family engagement. Accomplishments include completion and dissemination of developmental screening guidelines for early childhood and community providers, contracting with 2 community-based programs through the Federal Early Childhood Comprehensive Systems Grant to increase screening on Maui, and completing collection and analysis of screening data to improve outreach and referral activity. Our plans moving forward are to continue to support and document screening and system building efforts on Maui, work with state partners to promote developmental screening through policy and planning, and work with families and parent organizations to develop family-friendly materials on the importance of screening and child development. Priority 5, improving oral health of children. The 2 strategies are building the state oral health program to assure leadership, data surveillance, partnership development, ongoing assessment and state planning, and completion of a teledentistry pilot project at WIC, Head Start, and preschool programs. FHSD has completed a year-long oral health strategic planning process and an oral health screening survey. The State Oral Health Coalition has been re-established. The virtual dental home teledentistry pilot in Kona early childhood settings is in its final year, having reached 471 children. The project was accepted as a promising practice in the AmChip Innovation Station. A second pilot site has been started on Maui, targeting young children as well as a senior assisted living facility, and includes training with the Maui Community College Dental Hygiene Program. Future plans include publishing the State Oral Health Strategic Plan and Survey Report, securing funding for the program, and demonstrating effectiveness and sustainability of the teledentistry program and expanding to other locations. Priority 6, reducing the rate of child abuse and neglect from ages 0 to 5 years. Strategies are to continue Hawaii's MIECHV program, build a surveillance system, systems assessment, and partner development, and to support training and technical assistance to promote safe, healthy, and respectful relationships. The Your Ohana program reached 840 households and made over 10,000 home visits. Workforce trainings were conducted. FHSD staff and partners helped develop a preliminary work plan for the CAN prevention program. A proposal was also submitted to finalize a work plan and sustain implementation efforts. Violence prevention workforce trainings and evaluation will continue. A final CAN prevention work plan will be finalized and implementation begin. Technical assistance will be secured from the MCH Workforce Development Center to help sustain and guide implementation efforts. Adolescent Health, the focus is to improve development, health, safety, and well-being through wellness visits, and for children with special health needs, the focus is transition from youth to adult care services. Priority 7, there is an art and science to improve the development, health, safety, and well-being of adolescents. The development of an adolescent resource kit with a corresponding training and education series are the strategies being employed to maximize adolescent wellness visits. Based on input from stakeholders and youth, an ART targeting teens will be developed with age-specific topics using online platforms. Activities are conducted through collaboration and consumer engagement. In partnership with the Hawaii F2F HIC, lunchtime webinars were conducted for pediatric specialists on adolescent wellness visits. Work was also begun on the ART for teens, including drafting and review with a focus group of teenagers. A youth summit was held to test content and dissemination methods. Lastly, partnering agencies launched a major messaging campaign to promote the new policy requiring adolescent wellness visits for entry to 7th grade. The campaign included PSAs, posters, ads, and direct messaging through schools and insurers to parents and caregivers. Plans include training and technical assistance for adolescent health providers to encourage teen-centered wellness visits, further refining the ART for teens, and partnering with the DOH Chronic Disease Program to promote mandated 7th grade wellness visits for school entry. Priority 8, promote transition to adult healthcare. The major strategies are standardizing procedures and data collection for transition in the Children with Special Health Needs program, promoting statewide education and awareness, and integrating transition services into the standards of care of community programs and agencies via collaborations. In the past year, the transition policy and protocols have been implemented and evaluation is ongoing. The new database is live and improvements continue, and annual transition fairs and presentations were conducted in partnership with state and community agencies serving youth and their families. Plans include further evaluation of the transition materials and protocols based on family and staff input, completion of the CSHN program database so transition can be tracked, and continued supportive education and public awareness events with agency partners. For the optional cross-cutting systems building domain, the priority selected is to improve the use of telehealth across FHSD programs. Strategies for increasing the use of telehealth are workforce training, infrastructure development, and provision of services, education, and training. Online and in-person telehealth training has been conducted for 16 people who administer FHSD programs, and telehealth services are being provided through all Title V programs. Offices statewide continue using video conferencing technology for meetings and provider education, including Project Echo Hawaii. Next steps and plans focus on 4 areas: telehealth infrastructure development, workforce development training on telehealth applications and skills, direct service provision using telehealth, and education and training programs using telehealth resources.